morning. This is our update for February 2nd, 2021. Next slide, please. Before we get into the current state of things, I thought we should take a moment and reflect back that it was this time a year ago where we started having our first meetings. COVID started showing up in the United States, and with our partners started preparing for COVID's arrival in Kansas and then later in Saline County. So in the preparation and planning phase of things, and in the response to this, with going on a year now. Next slide, please. All right, so this is your national outlook for the last 2 weeks. U.S. cases for the last 2 weeks are slightly down from the previous 2 weeks, as well as U.S. deaths. Next slide, please. State situation over the last couple of weeks. I believe that number of 16,000 cases is probably the lowest number of new cases in the state over a 2-week period that I have seen in recent reporting periods. The same with the statewide deaths, so there's some improvement there. Next slide. And more importantly, we can see in the last 2 weeks, we've had significant improvement here in the county. Over the last 2 weeks, only 418 new cases, and thankfully, only 6 deaths have been reported. So we've had reporting periods finally where we were able to say that there were no new deaths, which is a very positive thing. Hospitalizations still continue to remain low. Our 2-week percent positive rate is staying well under the 10% lately, which is good. It continues to trend in the right direction, as well as our 2-week incidence rate, which is trending in the right direction. That per 100,000 is simply a benchmark that is used so that counties can compare apples to apples from county to county. So, next slide. So looking at the cases per month, we can see January was much better than both November and December. Again, we see that trend is looking better. February, so far 57 cases in February, but that's still much better than what we have been seeing. In fact, our 2-day average, where at one time we were having 100 cases per day, has been less than 100 on our 2-day average. So we're still going in the right direction. Next slide. Same thing, deaths were a little bit higher than November, but much, much lower than December. And at this time, none reported in February, which granted it's only the 2nd of February and it's still early, but still we're headed in the right direction. Next slide. Still have a lot of clusters that we're continuously monitoring. No real change there. Next slide. There are no other major testing events scheduled at this point. There is the free testing site still at the Church of the Cross. If somebody wants to get tested again, they can go to that website, gogettested.com/Kansas, and then book a date and time in order to get tested at that site. Otherwise, it's still at this point through your primary care provider. Next slide. Vaccine updates. So we are right now in phase 2, which includes all those over 65, congregate settings, and in high risk or high contact critical workers. And I'll go into that in a little bit more detail in a minute. Originally, we tried open appointment system, and although that worked, I think it worked a little too well and was hard for people to be able to register that had issues with technology or a lack of technology. So last week we transitioned everything to a registration system, and then as doses become available, because our current estimation is only about 500 doses a week, then we can pull from that list and be able to get people scheduled, which currently is those over 65. The Saline Senior Center has been a great partner in helping people get registered over the phone. For those that don't have computers or internet, and as you can see right there, as of yesterday, there are currently over 6,000 that are registered. But at the rate of vaccine availability, this is going to take quite a long time still. Our short-term goal right now for those over 65 is to get about 30% of the over 65 population based off of our current U.S. Census numbers. Excuse me. Which would be about 3,000 people in that over 65 category. And we're about halfway there right now. So we're still looking at least another 2 to 3 weeks before we reach that 30%, and then we will start adding in additional groups that are in that phase too. KDHE has listed a comparison of what the individual counties are getting for doses on a week-by-week basis. So if you're interested in looking to see what other counties around us or what, how the distribution is looking across the state, that county vaccine distribution comparison link there will show you how many doses each county is getting. Next slide, please. So as I mentioned, phase 2 is that persons over 65, those in congregate settings, and those high contact critical workers. And I've included in our slides, and if you'll go to the next slide, please, what the KDHE definitions and examples of congregate settings are. And you can see that includes homeless shelters, congregate child care institutions, emergency shelters, correction facilities, adult care homes, etc. And then on the next slide, the high contact critical workers, that's our law enforcement, first responders, corrections, firefighters, grocery store workers, and the list goes on. You can see from those slides, including our over 65 population, that is going to be a significant portion of our population. And at the current rate of vaccine coming in, it's going to take us quite a while to get through all of those. So I ask, people to understand that this is going to be a slow process. We have a vaccine planning team that's been meeting since December weekly, looking at what the doses are coming in, what our numbers are, what we can expect, trying to plan out as far as we can, which is really only short range still because of those projections. Everybody that wants to be able to get vaccinated will eventually be able to get vaccinated. It's just going to take quite a long time. Next slide. So as we're putting out information, most people want to know, how do I find out what's happening? So we have many ways in order for people to get up-to-date information. One of them is through our press release on Monday, Wednesday, and Fridays, and our Vax Facts, which we try to include all of the most up-to-date information on vaccines in Saline County. Those are released on Tuesday and Thursday, and the link is there for people to sign up. I am also on KSAL providing updates on the first, third, and fourth Thursday at 8:15. I've been on KINA morning radio show every Saturday for almost the last year, providing updates. We have our social media for both the Facebook and Twitter. Last week, we recorded our first FAQ Friday video that aired on the Saline Media Connection, and the link is there if you want to go and watch that on their YouTube channel, where we try to cover some of the most frequently asked questions, hence the FAQ Friday, and provide answers to those that we can in general terms. And then, of course, our saline.org coronavirus page, where we have a lot of the links for much of this information. Next slide. So now we have kind of come full circle, where this time last year we were sitting, watching, waiting, preparing, planning to see what coronavirus was going to do and how it was going to affect things. And even though we've seen significant improvements in the county, we're still in a watching, waiting, preparing, planning, learning phase, as there are variants or mutations of the coronavirus that are popping up. There are several factors there that I've listed about why it's important that we watch these. We have already heard about some increased contagiousness, of course, with the UK variant. As of right now, what I know or what I have been able to get from information is that the vaccine will still work against most of these variants. There might be some differences later on as more information is learned, but we continue to watch and learn and see what's happening. So that means that people need to continue to remain vigilant about their mask wearing, their social distancing, watching their groups, their hand washing, staying home when they're sick. Last slide. And so, of course, that means continuing the mask order. And then also I added this last bullet in here. In case everybody wasn't aware, I was notified yesterday that the CDC has passed a federal health order that requires masking on all public transportation. So airlines, buses, trains, and that also includes train stations, airports, bus stations, transportation hubs, and the like. And that went into effect last night at 11:59. If anybody is interested in reading the full details of that order, I have provided the link there for that order. It doesn't really change what we're doing here in Saline County because we already have local mask orders, but anybody that's going to be preparing to travel will need to make sure that they are aware of those new rules. And with that, that concludes my presentation this morning.
Great. Thank you, Jason.
You're welcome.
Jason, this is, if I might, this is Commissioner Vidrickson. And you kind of touched on it, but I just want to clarify it. Last Monday and Tuesday, I know that we the health department, along with Saline physicians, gave out about 900 doses through Monday and Tuesday.
Yes, sir.
But later on, I heard that there was also a vaccination clinic on Friday. Is that the case? Was there something that happened on Friday also?
Not through our side. I think the hospital had some that they had to use up still, but okay. Ours was Monday and Tuesday. Now, okay. Keep in mind, while these vaccine clinics are ongoing, and that's one of the logistical challenges with this, is that while we are doing, like last week, Monday and Tuesday, we did shot 1, we are also now into those windows where we are doing shot 2 on a lot of the few hundred shots that we gave throughout the beginning of January. And so we are getting into this consistent cycle where part of the week will be shot 1, part of the week will be shot 2. And so that's that ongoing amount of time and effort that goes into that.
Will there be cases or situations where primary or doctor's offices or clinics that they receive doses also and will be administering them?
I think further down the road, I know that was in part of the overall statewide plan that those different areas, including pharmacies, would be able to provide vaccinations. The challenge right now across the state is there's just not enough to add in a bunch of different other providers, because that 500 is all we're getting as a county.
Right.
Nobody else is getting any. It's just that 500, and when you add in 5 or 6 other providers trying to give, then that really dilutes out that availability. So once the numbers get up, that is, I know that the plan is for there to be many more providers, many more opportunities at different places to be able to get it. And if the Johnson & Johnson one that is now, I think, getting close to or about to end its phase 3 trials is provided emergency use authorization, that'll be another option for being able to get the public vaccines besides the Pfizer and Moderna.
Okay. Well, and the reason I asked, Jason, was that I heard it was that the the vaccination site was still out of J.C. Penney's, and I thought we were involved with anything that would happen out there, and that's why I was asking about last Friday, because I hadn't seen anything about that. So, but that was someone else private that did that.
Yeah, so with that vaccine site, it is a joint project between us, Saline Family, and Saline Regional. And so, if in the future, one of them had wanted to try and do a vaccine clinic when we have more vaccine, but that would be possible through that site. However, we are all involved in the planning, the staffing, and the just being able to run that site, because it is quite a bit labor intensive too.
Right. One other quick clarification. As far as the people that are on the list for the future, I mean, I assume that they called by Salina positions and taken in the order of which they signed up. Is that how that works?
Right. So everybody that has registered, it goes into a master list on the back end. And so like right now, since we're still focused on those over 65, Salina Family, as helping to manage that list, will be calling people in the order that they registered, though, for those that are over 65.
Okay.
We start adding in other groups from those other phase 2 categories. That list is then sortable so that we can get, those that are over 65, and then whatever other group, because one of the questions on that registration does ask, do you live in a congregate setting? Are you a high contact critical worker? And then what field do you work in, so that we can be able to sort it that way as well. Registration also helps us in planning. So when we're looking at, say there are, say that there's 1,200 teachers, for instance, then we know that helps us with the planning of, okay, how do we try to manage trying to vaccinate all of a certain group?
One last question or comment. I'd like you to kind of clarify a little bit. And the ever-present rumor mill has it that on Monday and Tuesday last week that there were people from out of county, people from out of state even, getting vaccinated at the Penny's site. Can you comment on that one way or another?
I don't know about out of state. There might have been a few from out of county. We did clarify as part of the registration process after that you have to either live or work in Saline County in order to register and get vaccinated here.
All right, thank you.
Jason, Commissioner Weiss here. I got a couple questions. The first
Yes,
question, with the new type of putting in your name into the hat, the old system you had, you got a confirmation back that you would be receiving this or that. Under this new system, is there any way that people can get confirmation that yes, you are on the list?
Yes, sir. We are working with the technology to figure out how we can get that. At first, it came up with a confirmation page, but we realized that a lot of people are looking for that confirmation email or something of that nature. So we're looking at how we can leverage the technology we're using to make that confirmation happen.
Okay, so, and that's going to happen on these people that have registered.
Right. So the ones that have currently registered, once we get this technology part figured out, which I hope we're able to this week, then everybody that's currently registered will get their confirmation email, and then anybody registering from this point forward will get their confirmation email.
Sounds great. I was just concerned because I know you don't want to be besieged with people calling in saying, hey, am I on the list? Am I on the list? I mean, you don't have time for that or the staffing to do that. So I just thought that would be a way for people to know, yes, rest assured you are on the list, and when your time comes, you will be contacted.
Yes.
My second question is, you mentioned when you hit the 30% threshold of 65 and older, you would start doing critical workers and other portions of the population. will the 65 and older continue to get some, just not 100% of them? I mean, are you still
Yes,
going to bring the 65? Okay.
Yes, sir. If we waited, looking at the census numbers, there's a little over 9,000 or so over 65 based off the census numbers. And so, quite honestly, at about 500 a week, it would still take us, probably 16 weeks, something like that or more, just to get through them. But no, we will still be doing over 65 and adding in some of those. So the mixture, when we meet this week, we'll be talking about how we're going to start trying to figure out that mixture. But we still will be doing over 65 as well.
Thank you.
Commissioner Shadwick here, and I was contacted by a nursing home that not received any of, nobody's gotten a shot yet. And I know that that's not that's going through Walgreens or CVS, I believe, and that's,
Well, I spoke to them yesterday and we got what the back issue was figured out. So we're trying to work on a solution now for them.
good. And is that through Walgreens or is that through us or?
Well, so with the CVS and Walgreens, they were primarily contracted to provide it to long-term care facilities,
Okay.
not necessarily retirement communities and assisted living. So there was something that kind of fell through there. Either way, I talked to the director over there at that facility yesterday, and we're trying to get a solution worked out so that we can get their residents taken care of.
Thank you for that follow-up. Appreciate it.
Yes, sir.
Hello, Jason. Roger here.
Yes, sir.
Quick question here is like in a statement you made a little earlier is that that you're putting in all these people that have signed up are in a list, and that's how you call them back as how they entered in, right?
Yes, sir.
Okay. And now at 30 or 35%, now you start accepting more. And let's say a 92-year-old person has signed up and now they keep getting bumped because you've taken all these new people in. How do you arrange those numbers when you start taking in new people? And
So-
who do you,
I see where you're going. So those that, for instance, and I'm just using a hypothetical right now because we haven't finalized our procedure on that. But say, for instance, with our next run of doses, say we get 500 and we say that we are going to do, I don't know, an 80-20 split, 80% over 65, 20% of other, and that high contact critical worker. So since it's all in a spreadsheet still, we'll go down that to whatever number fills at 80% still of those that are over 65 who have signed up, and then we will start through the other categories in that 20%.
okay.
So those that are over 65, it's not like they're going to get bumped. It just means that in this run, we won't be able to take 500 over 65, for instance. It'll be a less number, but they're still in their same place on the list based off of when they signed up.
Okay. Thank you. That good explanation. Yep. Thank you.
You're welcome.
Any other comments?
Jason, one last question. Commissioner Weeds here.
Yes, sir.
Did you receive any vaccines last week that you were giving out this week?
Yes, we have 500 that we are doing that we received last week that we are vaccinating with this week. We are estimated to get 800 this week for next week. We haven't received all of that yet, but we are estimated that, so we'll be making appointments for potentially that many next week. And then whatever we get notified of this week that we will receive next week, we'll make appointments for the week after that.
Okay. Any other comments? Okay.
Yes,
So
I have a comment,
Oh.
Mr. Chair.
Yes.
Jason, I've heard good reports for your vaccination facility. It seems to be running smooth, and a few wrinkles worked out at the start, but congratulations to you and your partners you're working with to make that successful.
And I appreciate that. And I do want to give another shout out to them real quick, to Salina Family and Salina Regional, because without that partnership, trying to run this facility like this and do this many vaccinations would be an extreme nightmare. And so it's with those partnerships that we're able to do what we are doing here in Saline County to try and improve the COVID situation, as well as trying to get people vaccinated. And those partnerships are extremely important. So I just want to give them one last shout out before I wrap up.
Okay, thank you. And I'm sure there's a consensus just to go ahead and leave the face mask going as for the next 2 weeks. Seeing that, thank you, Jason.
All right. Thank you, gentlemen.